guests on this show, and unlike the host, I don't believe Rush has ever had the misfortune to be treated at the Royal Victoria Hospital in Montreal or at the Queen Elizabeth Hospital in England. I've been treated in socialised hospitals. And the one thing you learn about a socialised healthcare system very fast is that the only way of controlling costs is by restricting healthcare for you. You're the only variable in the system. On Friday afternoon, the health system still has to pay the doctor and the nurse and the janitor. The only way of controlling costs is to restrict access to the system for you. Now, if you don't mind that, if you don't mind a system in which you become the point at which costs are controlled, then fine, go along with government healthcare. What it means, the essence of a government system, for people who've never lived under it, is waiting. You wait for everything. You wait years for operations that in America are routine. Routine operations, you wait for years. There was a story in Le Journal de Montréal last week that in the province of Quebec, people with severe incontinence, that's to say, people who get up to use the bathroom a minimum of 12 times a night, have to wait 3 years for a simple half-hour procedure. Now, when people talk about comparative costs of healthcare, they don't factor in, for example, the fact that you've had a sleepless night because you've been getting up to go to the bathroom 12 times and the consequent impact on your work performance every day, 7 days a week, 52 weeks a year, for 3 years. All those trips to the bathroom, 12 times a night, 365 nights a year for 3 years while you're waiting for a simple half-hour procedure that you could get at a week's notice if you drove an hour south of Montreal to Plattsburgh, New York, or Burlington, Vermont. The essence of a government system is that you wait and wait and wait because you, the patient, are the only point at which costs can be controlled. Marginal and you can never spend enough on healthcare because the outcome is always going to be a disaster. You're still going to die. We can spend even more trillions and trillions and trillions on healthcare, and you are still going to die. Even under President Obama, he can lower the rise of the oceans, but even President Obama has not found a way yet to eliminate death from the American way of life. So there is never, ever going to be a perfect healthcare system. And the reality is that all these bits and bobs about life expectancy rates and all the rest are marginal. What is at issue here is liberty. Once you have government healthcare, it licenses the government to do anything in the interests of healthcare. For example, in Britain, they deny hip replacements. In some parts of the country, in East Anglia, I think it is, they deny hip replacements to the overweight on the grounds that they overweight and made their choice to chow down on Twinkies, and so they're not going to be rewarded with a government hip, even though they paid for it in their taxes. In Manchester, they will deny you treatment for heart disease if you're a smoker. You made your choice, you lit your cigarette, so even though you've paid enough in your taxes for like 3 chronic illnesses every year, we're not going to treat you for this. And the health secretary says it's entirely appropriate to make, when you have a government system, to ration healthcare on the basis of lifestyle choices. So that basically means that once you have government healthcare, the government can impact any other area of your life. They've installed these security cameras. These things, these cameras they have on the interstates or whatever to check whether you're speed cameras, to check whether you're speeding. They've now installed super duper cameras that can see inside your car to see if you're eating a cheese sandwich, to see if you're eating a donut. Because you're no longer allowed to eat in cars in Britain, because if you, and for the same basis as they did with the motorcycle helmets, if you have a crash, if you have an accident because you're having a cheese sandwich in your car, you have to be treated in a government hospital at government expense. And so that simple fact of government healthcare redefines the relationship between the citizen and the state and enables them to pass a whole bunch of other laws in respect of all kinds of other activities. That's what's wrong with it. As I said, these things are all in the United Kingdom. You go into hospital to be treated for disease A, you will come out with disease B, one of these strange infections that now essentially exist only in hospitals. If you go into a hospital, you get them. My father's currently being treated in a British hospital, and every time he goes in, he comes out with this thing called C. difficile. C. difficile is essentially a hygiene issue, and it's because socialized hospitals are so decrepit and the staff are so overworked that even basic hygiene procedures are not observed. Another friend of mine miscarried. She felt herself miscarrying, went to the Royal Victoria Hospital, started to bleed sat there in emergency, bleeding all over the floor, the pool of blood spreading all over the floor to surrounding persons in the room. Eventually, a nurse came out, said that you'll still have to wait for the doctor. By the way, could you stop bleeding? She said, I can't stop bleeding, I'm miscarrying. A cleaner comes through with a dirty mop, wipes the blood, streaks the blood up the corridor, past everyone, all the dirty blood up the corridor, into whatever the next ward is. But she's run her mop over it once, and so that's okay. Chlamydia. If you don't know what chlamydia is, consider yourself very lucky. Labrador, the Labrador healthcare system gave whatever... In Labrador, there's nobody in Labrador. It's like there's mosquitoes the size of golf balls and a few Inuit, and that's it. But otherwise, nobody in. It's where like your big shot, you're a really highly skilled fisherman like to go on fishing trips. It's almost as good as the beaches at Palau. So maybe we'll see Uyghur fishing tourism in Labrador. But Labrador, the hospital there, gave chlamydia. And as I said, if you don't know what it is, consider yourself grateful. Consider yourself very lucky. They gave it to like 120 women in this one hospital because they didn't rinse the spatula or whatever you call it between patients. Because, you know, when you're in a socialized system, you're always short of everything. There's never enough of anything. There's never enough time. What happens? You don't wash your hands between patients. You have one cleaner with one dirty mop for 2 floors of the hospital. You forget to wash the spatula or whatever you call it, between patients. You go into hospital and you come out with a new disease that you didn't previously have. That is the big problem. That is one of the things that happens with socialized healthcare. Now, here, I love it when you go in. I love the character of American hospitals. When you go to. Too often when you go to hospitals, I've been treated, and I hate to make it sound as if I'm this wee sickly little thing. I've been treated in a lot of hospitals. I've been treated under the Bulgarian healthcare system, which is an interesting glimpse of how you'll be. I went on a skiing trip to Bulgaria. It was a great deal. And there was a reason it was a great deal. It's because the toe lift broke my knee on the first day. Because it's not like these sophisticated lifts you'd have at Vale or whatever. So although it only cost $37, it ended up tearing a ligament. So put a big cast on me, a big plaster cast. I get back and they saw off the cast, and I'm like howling in pain as the doctor's sawing it off. I'm going, ah! And he goes, you big sissy, you big fairy, you big girly boy. What are you screaming for, howling in pain? He gets the cast off my leg. There's a huge gash from my upper thigh all the way down to my ankle. He goes, oh, I guess they use really thin plaster in Bulgaria. That is socialized healthcare. They save on everything. There's never enough on everything. And yet the cost of the system, because of the cost of the bureaucracy, is just explosive. We're talking about healthcare on the Rush Limbaugh Show, and we will have lots more straight ahead on the EIB network.